Okay, good afternoon, everybody. I think we just got one or two more people joining, but I'll make a start as we're on the hour. Welcome to this, which is the third in our series of lunchtime webinars, where we delve into anything and everything to do with innovation across NHS Scotland. So anything to do with innovation across medtech or health tech landscapes. Just to say, we do record these webinars. So you can watch them back afterwards if you're not able to stay for the whole thing, or you can watch them later if you prefer to as well. I'm joined today by my colleague Leigh Mair, who is our innovation manager based up in the north of Scotland. She's based in Elgin, in fact, and works with NHS Grampian and the Northern Boards quite closely. I myself head up the innovation team at InnoScot Health, or SHIL as we used to be known, and together, we go out and we meet the clinicians that have good ideas and we explore their innovative ideas with them. We're also joined today, and very fortunate to be joined today by Dr. Neil Patel, who will be speaking later on. And the purpose of this webinar is really to explore a little bit about the topic of innovation calls and challenges, which is something that we've been hearing a lot about over the past few years across the NHS, across the wider sector. We've run a few calls ourselves, and that's what we'll start with talking about. And then later on, we'll open it up and we'll invite Neil in to talk about the wider NHS and government perspective and a particular area of focus and need. If you have any questions that you want to ask us, do drop them into the chat at any time. And we'll have a Q&A session at the end and open it up to the participants. Do also use the chat as well if you have any comments for us or suggestions. If you think of any topics you'd like to hear for future webinars, if there's anything you want us to cover, any speakers you want to hear, or if you want to spark a bit of a debate with your colleagues who are on the call, by all means use the chat for that. It's always good to get a bit of a discussion going there. So we'll start with explaining what are innovation calls. They mean different things to different people. We've been running them for several years now. We actually started around about the time of lockdown, the first lockdown, simply because we were all at home, we were all working from home, and it was a struggle. It was a struggle to get, I suppose, to get out there and talk to people. We tend to run 1 or 2 calls per year. We do these to raise awareness of our activity, to spark areas of need across the NHS. We've run several in the past few years. We've done some on COVID, as you can see there. We've done some on sustainability, frailty, which I'm going to talk about in a second, ophthalmology, and then a new one on pregnancy and perinatal, which we'll cover in a second. So to talk about our frailty call, what I'm going to do is just recap why we ran this call, what this call was about, and some of the results from it. And the reason for talking about frailty is because I suppose, unlike COVID and some of the other calls we've done, frailty is very, very, very topical and will continue to be. There's always going to be frailty. It's always going to be an issue and a particular need, an area where innovation is needed. And frailty covers a lot of different areas. There's just a few that I've mentioned here, things like stroke, dementia, things like orthopedics, osteoporosis. People who are frail, people who are elderly, but not necessarily elderly. It covers things like falls prevention, hearing loss. It's a really wide area. And what I want to do now is actually show you a very short clip, which
to introduce Dr.
Show you a very short clip from which we filmed a while ago for our frailty call. Dr. Susan Schenken, she's a consultant geriatrician at NHS Lothian. And she gives a really nice definition of what frailty is, which I think emphasizes for anyone working in that, the importance of it and why it's something that we're focusing on.
Schenken from the University of Edinburgh. Can you first start by defining what's meant by frailty in a clinical setting?
So I'm Susan Schenken. I'm a clinical academic, which means that I'm a doctor. I work in looking after older people living with frailty in the acute hospital in the Royal Infirmary in Edinburgh, and I'm an academic doing research in a wide range of areas to do with ageing and associated conditions at the University of Edinburgh. So I'm a reader in the geriatric medicine department as part of Usher. So frailty, what is it? Well, it's really a commonly misunderstood condition, I think, because frailty is in everybody's speech. So we understand frailty in different ways colloquially, but academically and as a technical definition, it's defined as a multi-system disorder that increases your vulnerability to poor outcomes following a stressor event, and that increases your risk of disability or death later. So it's really the lack of ability to bounce back after something bad happens to you. It becomes more common with age, but it's not the same as with age. So for example, about 10% of people over the age of 65 or about 25% of people over the age of 85 would be defined as being frail, according to the technical definition. So that means that the vast majority of people...
Oops, sorry for that. So that was actually the end of the clip, so I will move on. So what we did with our frailty innovation call, we went out with a package of support, which we advertised across comms across the NHS. Our calls typically provide a package of regulatory support, project management support, the expertise that we have within the team, and up to about £25,000 of initial funding to develop ideas that fit within you know, our remit and our process. And what kind of ideas did we get? We had a lot of different things come in. You'll see the pie chart on the right there. We had a lot coming from the NHS itself, some academia, third sector. Also, in terms of topics and things that were covered and ideas that we got, we had a lot of things to do with social care and things for care home residents. So things like hoist devices and wound dressings were very topical, very common. Probably one of the really hot topics that we had was to do with falls detection and falls prevention. And one thing I would say is if you are working in frailty and working in this area, we spoke to a lot of companies during this call, companies that work on using software for, falls detection, falls prediction. And a lot of the feedback we got was that although the falls detection area is quite saturated, the falls prediction area is something that really does need innovative ideas and innovative support. And it's a really kind of hot area. And so you may know there's quite a lot of companies out there now that are working on apps, on software, on systems that will help to predict falls and predict falls risk and sort of stratify those patients. Because if you obviously can prevent falls, then you can save a lot of time, money, and obviously, patient morbidity and death, and prevent that as well, which is hugely important. As well as that, we had a number of things come in for technologies for visually impaired, including there was one to do with providing some sort of GPS-based system for visually impaired residents of care homes, and also alert systems for care home staff as well. So of all of these, there's probably, I think, 2 or 3 that fit within our criteria of how we support projects and what we support. And of those ones, we're now working to develop those. What I would say is the frailty call, it is still kind of open in a sense. We haven't really had a firm closure of it. We were always happy to take good ideas and good innovations from NHS staff and talk about those. So if you do have any further ideas related to frailty, related to some aspect of frailty, do drop us a line and let us know. So with that, I'll hand over to my colleague Leigh Mair, who's going to talk about and introduce a new call that we're doing on pregnancy and perinatal. So Leigh, over to you.
Thank you, Robert. Hi, my name is Leigh Mair. I work in the north of Scotland, including the islands. And I'm going to be taking you through the next couple of slides before I hand over to Dr. Patel. And we're going to explore a little bit of the new innovation call, which InnoScot Health is launching around pregnancy and perinatal. So why are we doing this call? Well, there's several reasons, really. It ties into Scottish Government's Getting It Right for Every Child policy. And I will put these links to the policies in the chat when Dr. Patel's speaking. And it also links to the Scottish Government's long-term plans for women and children around maternal and child health. And frankly, we know that this from statistics that this is needed. So for example, in 2020, women were 3 times more likely to die by suicide during or up to 6 weeks after the end of pregnancy compared to 2017 to 2019. And we know that there's quite a lot of health inequality around this topic as well. For example, Black and Asian women have a higher risk of dying in pregnancy, with white women being around 9 and 100,000, mixed ethnicity women 12 and 100,000, Asian women 16 and 100,000, and Black women 34 and 100,000. So quite shocking statistics, really. If you move on to the next slide, thanks, Robert. So what can we offer in this innovation call? Like the frailty one, it's up to 25,000 package of initial funding. We offer in-house regulatory support, in-house project management expertise, and also extensive innovation expertise. Next slide, please. So what are we looking for? I don't want to make it really prescriptive, but things like devices for managing and monitoring pregnancy, some innovations to improve labour and delivery, some technologies for neonates needing specialist care, for example, support for women experiencing mental health problems. It says after delivery here, but that could be before delivery too, and improving outcomes for mothers with comorbidities, especially around diabetes, etc. Next slide. So an example of something that we've worked on before is the ambulance child restraint. So the ACR was developed in response to the need to transport children safely in an ambulance where existing support and restraints had largely been designed for adults and where children were often simply carried in their parents' arms. So the product was designed by Lightweight Medical Limited on behalf of the Scottish Ambulance Service and licensed to Part Aid Medical for manufacture before ultimately being assigned to them. Show, as it was at the time, worked with all the parties to fund design and development, IP protection, and also put in place the necessary legals. So I'm delighted now to introduce Dr. Neil Patel, who is a consultant neonatologist and who's joint clinical innovation lead for the West of Scotland Innovation Hub. Neil's going to be speaking about women and children's health, what the West of Scotland Hub are doing, and why this is important for NHS Scotland innovation. Thanks, Neil.
Thanks very much, Leah. Really delighted to join you all today and to be speaking on this topic. And it's really timely, obviously, with the pregnancy and perinatal call that InnoScot are launching, and really excited to see that call. And hopefully it's going to align nicely with other innovation work that is being catalysed here, not just within the West of Scotland, but across the country as well, through the innovation hubs and through government support for them. So I'm hoping to share a little bit of all of those with you today. Hopefully you can see my slides okay. Leah, can you give me a thumbs up if you can see them? Is that okay? Brilliant, that's great. Okay, so I want to just start by framing why innovation is important and why we're taking these approaches. And this is a quote from a recent Health Foundation report about successfully scaling innovation in the NHS. And one of the key messages from that is this message that the pressures and challenges currently facing health and social care can only be addressed if outcome improving, experience enhancing, and value adding innovations can be rapidly identified and adopted. And they go on to say that radical, perhaps even disrupting innovation at scale has become a necessity, not a luxury. And I think that's a really important message. There's a tendency to think about innovation as an add-on, nice to have, but in the current era, post-pandemic, with all of the challenges that we have, with the significant backlogs, delays to treatment and access to services, along with challenges of early diagnosis and optimized management, we really need to look at how we embrace innovation to solve those challenges, because doing things the same way as we always have in the past is not going to do that. And one of the models of supporting innovation within NHS Scotland is represented in this slide here. It starts on the left-hand side by thinking about who is going to come up with these innovative solutions. And we're not going to generate them all ourselves in the NHS. We neither have the skills nor the time to do that. So we need to partner with colleagues who can do that. And that means industry and academia. And you saw their willingness to work on innovation from Robert's data around the frailty call and the different proportions of those colleagues who have applied for that. It may be that as we work towards solving a challenge, actually we can bring in already solutions that are on the market or emergent products that are not at a commercializable stage but have already been developed to some point, or existing spin-outs from perhaps some research within academia. But the aim is ultimately to get to the other side of the funnel, develop a solution that we can deploy absolutely into the NHS to solve the problems that we've got, but that our partners in industry and academia can then spin out and commercialize and sell to other markets and other healthcare systems. And in doing so, hopefully grow the economy for Scotland and the wider UK and build our skills and capacity within the life sciences industry. And the question is, how do we in NHS Scotland contribute to that model of innovation? And what are the practical components that help us to do that? And along with the great work of InnoScot, I just want to help give you a little bit of structure around the innovation hubs and their relationship to a national entity, SHIP, Scottish Health Industry Partnership. SHIP is actually part of Scottish Government. It's a combination of the Chief Scientist's Office plus Offices for Economic Development. And it really aims to address that dual role of developing health innovations that solve, really important clinical challenges, but at the same time helping to grow the economy of the country. And the test beds, of which there are 3, one in the west, one in the north, and one covering the southeast. So they're not associated with individual boards, they're associated with the boards within each of those regions, the health boards in each of those regions. And the test beds really provide that working interface between that ambition and us, the people on the front line who understand the challenges and can help to come up with the solutions and work with those industry and academic partners and support partners like InnoScot to hopefully develop useful solutions and to implement, evaluate, and then scale them. And so I work within the West of Scotland Innovation Hub, but also work with SHIP on one of their particular challenge areas. I'm going to come on to that in a second. This is a very busy slide. I don't want to go through any of the detail. Just look at the headings at the top. It's just to give you a sense of the kind of hands-on support that the hubs actually provide. In the first stage of innovation, the scoping stage or discovery phase, to try and understand really what the challenge is, what's the problem that we're trying to solve, and why is it important? Why will it be impactful if we solve that problem? Then supporting project delivery and a lot of functions there that align with the functions provided with InnoScot in terms of project management, but also expertise around governance, around the research ethics that might be required and access to data. And then also some experience in evaluating new innovations, whether that's software, whether it's a medical device, whether it's a transformation of a care pathway. But how are we going to do that? Are we going to use traditional research methodology, or perhaps there's more agile methodology that we can do that? And why are we doing that? Are we doing it to show clinical effectiveness, or are we also doing it to demonstrate health economic benefits and capacity generating impact within our services? And then also supporting the scale up of services. This is fishbone diagram, again, not to highlight specific projects on this slide, but just to give us a sense of the number of different projects that are supported within the hub at the moment and the areas that they fall into. We support projects that might be classed as early innovation, quite exploratory and conceptual, all the way up to projects that have gone through proof of concept, prototyping, initial clinical piloting, and are a wider service evaluation stage as well. And you also see the different types of technologies that are involved here, ranging from software solutions, medical devices, wearables, and AI. And I want to focus in on women's and children's health, partly because it's the area that I'm passionate about. It's where I work in my clinical setting and where I feel most comfortable. And this slide is just to highlight what it already exists in terms of foundational projects and our real sort of experience in helping to support those ideas, those challenges that clinical colleagues have come up with, work with industry partners, and to develop solutions that we've then deployed and implemented and evaluated. First, on the top left is an example of vCreate video system. It was developed initially in our neonatal unit to help us to share short care videos with patient families, and we subsequently were able to adapt that successful service to create a remote digital service for families to share videos with us, particularly for diagnosis of epilepsies and neurological disorders. And those services scaled from NHS Scotland to over 200 centres worldwide now, being used for over 700,000 clinical interactions with patient families. And for the clinical service, we've done some evaluation work that has demonstrated that it's not only reducing waiting times by up to 90%, but also saving the health service up to nearly £700 per patient interaction. So a nice story that demonstrates the whole pathway of innovation. Other examples, bottom left is a new low-cost incubator developed with an SME called Mom Incubators. We worked with them through the design phases into a clinical trial, and we're delighted to support the clinical implementation. And as you see, they're actually being used in hospitals in Ukraine. That's where most of the devices are currently going as they come off the production schedules. Bottom right is a really exciting project. The challenge here that we're addressing is the long time that it takes to train families in home dialysis for children who've got kidney disease. And some of my colleagues have been working with academic colleagues with expertise in VR to develop a virtual reality system that completely accelerates the process of training both for staff and for families. Top right is a new system for analysis of electrolytes within babies' blood and scalable to other populations as well. That's a project with Strathclyde University and Trish Connolly and her team in the Department of Biomedical Engineering. So we've got some really great examples of projects across the country and a strong sense of how we can support these projects through hands-on experience. But the next question is, what are the priorities for the future and how are we going to support them? And this photograph is really to kind of highlight what are the immediate problems right now that have the highest priority that we need to solve. And SHIP at national level has been thinking about that. They've been thinking about the high level priorities for health in NHS Scotland. You see in the middle some of the chief medical officer's priorities around inequalities, and Leigh already highlighted those in relation to pregnancy and maternal health, but also sustainability. You know, workforce and sustainability are huge issues at the moment for us, both in terms of delivering services that are economically sustainable but environmentally sustainable, and maintaining a happy, healthy workforce to deliver those. In terms of specific clinical areas, there's a strong focus on long-term conditions and on cancer. And we need to think about how we position women's and children's health alongside those. I would argue that children are the adult patients of the future. So if we want to treat long-term conditions and minimize the impact of those, then we absolutely want to start in childhood and in pregnancy. Now, the approach that SHIP is taking to support innovation within those areas is a challenge process, which is in some ways aligned a little bit with the InnoScot process as well. It involves identifying a priority area, launching a challenge in that with some funding around it, and selecting industry partners for support to solve that challenge. The open innovation challenges through SHIP have a couple of phases. So the first phase brings in a number of industry partners who will each work on a proof of concept or very early prototypes. And that's quite a rapid process. And then if they're successful, or the best ones will be selected for phase 2 with some more funding to get them to a secondary prototyping proof of concept stage. Now, some of them may actually get to clinical evaluation and implementation quite quickly, depending on the type of technology and how well developed it is. Some of them may take a bit longer, and there may be subsequent phases and further funding that's required. In terms of priority areas, at a higher level, SHIP has identified what they've called catalyst areas. You see them on the slide here. And in each of these themed areas, these open innovation challenges are at different stages of progress, but many of them have launched already. Some of them have already engaged industry partners and are in the process of prototype development, phase 1, phase 2. I'm really delighted that women's and children's health is one of those catalyst areas, and we've been leading on the support of the catalyst process for that theme. There are some important strategic drivers and national policies that are helping to direct the innovation activity within this theme. And Leigh already alluded to some of these. Two that I would highlight are Women's Health Plan, which was published in 2021, and Best Start, which was a maternity and neonatal 5-year forward plan that was published in 2017. But because of the challenges of COVID, is very much still a live document and live priorities. And both of those are quite detailed. I just want to highlight for the Women's Health Plan some of the ambitions and focus areas, because these overlap very strongly with the InnoScot call. So within the Women's Health Plan, some of the relevant ones are access to services and information, and importantly within that, equitable access and addressing some of the current challenges, particularly around hard to reach populations, minority populations. Sexual health, contraception and abortion, which very much I would say aligns with pregnancy and perinatal health, as does menstrual health and endometriosis. And another important focus is menopause and also heart health because of the recognition that as a group, women's heart health has been relatively underrepresented. If you look at a lot of the studies in heart health over past decades, a lot of them have focused on male populations. So just briefly, our delivery mechanism for the Women's and Children's Innovation Challenges actually started with clinical engagement, because our bias is actually that if we want these challenges to be successful, they have to have the support, and they have to come from the frontline colleagues who truly understand what those challenges are. So we did some events and workshops in late 21, 22 to highlight innovation as an area and the challenge process. And then we had a call for challenges last year, and we received 23 challenges from clinical teams and colleagues across the country in paediatrics, neonates, and women's health. And then we went through a selection process based on certain criteria, including benefits to patients and the public, existing need for innovation, i.e. this sense that there was no existing products on the market that would meet the demand, i.e. a market failure, the project team, how much it involved patients and the public, and the suitability for this type of approach, because not all projects that came to us actually suited this open innovation approach. Some of them already had a preferred partner and weren't really at the right stage for this competitive funding approach. To cut to the chase, there are 3 successful challenges that were selected. They are in a perinatal challenge, which is around virtual neonatal care at home. And that's specifically looking at babies who receive phototherapy for jaundice, which is up to 6% of term admissions to the neonatal unit. And we believe that many of those babies could actually be treated at home. So this challenge will, when it launches very soon, hopefully over the summer, will focus on how we deliver and test for phototherapy and jaundice at home. And that's being led by a consortium through the Scottish Perinatal Network, headed by Dr. Leslie Jackson and Martina Roddy, neonatologists here in Glasgow. And it supports delivery of the Best Start priorities, as well as the key clinical priorities of all the neonatal units across the country. Second challenge is a Women's Health Challenge, which will focus on digital transformation of menopause services. It's led by a Women's Health Innovation Consortium that includes representation from Ayrshire and Arran and Greater Glasgow and Clyde. And it's a co-funded and co-managed project by SHIP and by CivTech. CivTech are a Scottish Government organisation who support innovation challenges, not just in health, but in wider areas of public and social sectors. And then third challenge is a paediatric challenge. It's looking at digital remote asthma management. It's led by paediatric colleagues in Lothian, and that one's going to be supported by the East Hub. For one of these challenges, at least, we've actually gone out to the market using something called a preliminary market consultation, just to understand what was already out there. And that was useful to help us see what products and services were already on the market. As it turned out, not very many, and that helped to reinforce for us that this open innovation call to develop new innovations is the right approach. So this is where we're at for a number of the different challenges that are being supported by SHIP, not just the women's and children's ones, but also the ones in mental health, eye health, drug deaths, dementia and cancer. Some have launched already, some are due to launch slightly later this year, and we'll look forward to keeping you updated on them. I just want to finish with one final simple but what I think is a profound message, which is this slide that represents an design approach to innovation and to solving any problem, really, which is starting in the first diamond on the left, truly understanding and defining your problem before you work on the solution. And for all of us as innovators, it's important that we recognize that first step. We can often get a little bit starry-eyed about the technologies and what they do, and we try to retrofit them to our clinical environments. But what we're trying to do here is really support a process that says, what is your challenge? What is the problem you're trying to solve? Because if we can articulate that, then when we start to work with companies and with academic colleagues, we'll truly co-design a solution that will have an impact. So I want to finish there. These are our details if you'd like to get in touch, and look forward to any questions you have. Thanks very much.
Great, thank you very much for that, Neil. That's been a really fascinating look at all the wider challenges that SHIP are running at the moment across a huge number of areas. It's really impressive that you're doing so many different things and so many kind of hot topics, and specifically in women and children's health. So we have time now, I think, for some questions. So I think, Leah, do you have any questions that have come in?
I've got one for Neil here. If you are a company that's developed a new product for women and children's health, how can they best approach the NHS to get support for the development and a potential NHS rollout?
Yeah, good question, $1 million question. So I suppose the first thing is, if there's alignment to the catalyst challenges, which in themselves are aligned to what we call a demand signaling program that is sought to identify what are the really impactful areas where we need that we can use innovation to solve challenges, then that's a great starting point, because the open innovation competitions are an opportunity for those companies to bid in. Now, that is at a early stage. It's to help the pre-commercial development of innovation. However, it may be that they've already got quite far down the development pathway, but are still very much in the running to apply for that challenge funding. It may be an adoption of an existing solution, an adaptation of an existing solution that helps to align it with the catalyst challenge, or it may be that actually there's just a little bit more development that's required to get us to the clinical implementation evaluation phase. So first thing I'd say is look out for the challenges and see if you align with any of those. If not, then engaging through the hubs or through HIAP, Health Innovation Access portal, which exists for the whole of Innovation Scotland, is a way of connecting with all of the innovation hubs and speaking to the teams within them to understand, is there a clinical group who are already working in this area who are looking for a solution that your product or service might address? Because that's ultimately what we're trying to align here. We want to make sure that those businesses have connected with us in that first diamond, or at the end of that first diamond, before they get far down the solution development stage, so that what they produce is truly going to be useful for us and hopefully then truly commercializable down the track. So if you think it's appropriate, apply through the Catalyst challenges, and they're advertised through Public Contract Scotland and Innovate UK. But otherwise, look out for HIAP, HIAP, as the portal to come in and connect with the hubs.
Fantastic, thank you. That's really clear. Here's one for Robert. How do people access the 25,000 attached to the InnoScot calls?
So it's important to say this isn't really like a situation where you apply for grant funding. The 25k is more of a pledge. So if a project comes to us after we evaluated it and it meets our criteria, we will pledge to spend up to that sum in the first year on developing it, whether that is prototyping it, protecting the IP, regulatory costs, and that kind of thing. I should say it's worth saying most of the projects that we get are medical device projects, and that's where our main area of expertise lies. And typically developing a new medical device from scratch takes quite a few years and quite a large sum of money. So once we've exhausted our own budgetary resources, we tend to go out and find larger sums of money through grant funding to take these further. Because as you can imagine, developing a new medical device, if it needs a clinical trial, it's going to cost a lot of money. It costs a lot to get things UKCA or CE marked and that kind of thing. So, yeah.
Thank you. Here's one for Neil. How do the innovation. So you mentioned that there's 3 different innovation hubs. How do they work together? Do they get involved in projects together, or do they work quite separately? Just something around the hubs.
Yeah, absolutely. Thanks, Leigh. The hubs absolutely work in collaboration, not in competition, and very much try to coordinate. So around the Ship Catalyst challenges, for example, there are different challenges that are being supported by the hubs, but very much through a process of collaboration. And there are also national projects that sit separate to some of the Catalyst challenges that might be led by an individual hub, but coordinating activity across the country. So a great example of that would be, for example, a National Drones Project, which has a number of partners, both academic and industry partners and NHS partners, and clearly involves boards across NHS Scotland, but is being led by or coordinated by an individual hub. So absolutely, it may be that you might connect with one hub as a company, but actually, because they have a good knowledge of what the activities are in other hubs, that they actually help to pass you on to or connect you with colleagues in other hubs who might be supporting a project that is more aligned to your company or your focus. And also just to update you on something I said before, and Fiona's kindly shared that with me. Instead of HiApp now, you can also if you're looking to connect more broadly with the ecosystem, the new URL to use is innovator.scot, and that will take you to Scotland Innovate's website, which will help you to connect not just with the right hubs, but also support within the wider innovation ecosystem, including through NSS.
Okay, thank you. Here's a question for, I guess, both of you. Innovation priorities and themes, how are they identified?
I'll let Neil tackle that one from his point of view first, if I may.
Good question. So for the Ship Catalyst challenges, there's a demand signaling group within Ship that seeks to understand a combination of national clinical priorities that align with national strategies, but also connect strongly with the individual boards and with frontline teams to understand where they see the really wicked problems, the major challenges that we've got to solve. And that group helps to assimilate all of that information and then hopefully align the innovation activity alongside it. And the Catalyst challenges, I would say, have been a really important step towards prioritizing innovation. Pre-pandemic, I would say that it was a more fluid system where there was a little more ground up innovation, but you would often see as a result that it was in quite specific niche areas. Now, some of that innovation is really important because often specific solutions that are developed for quite a small population can then be scaled for other areas, and we've seen that ourselves within women's and children's in the past. However, if we're truly going to solve problems at scale, it needs a little bit more coordination and alignment, and that's where the demand signaling group really has an important role.
Okay, thank you.
I guess just to, I mean, I think from our point of view, we've worked on behalf of NHS Scotland for over 20 years, and I suppose, you know, the ideas, the innovations that come to us, we tend to think of that as being a voice of NHS Scotland, but in fact, you know, we get all sorts of ideas and innovations, and some of them are very localized problems, some of them to do with particular geography in an area or particular lack of resource in an area. So it's actually really good that we now have this, you know, this better system that Neil's explained for prioritizing NHS need, because it means we can now run things like these innovation calls and target them in areas where they are really needed, as opposed to just kind of almost going out there a bit blindly in a sense.
Okay, thank you. And I guess just following on from that, Robert, I've got one here. What are the fundamentals you look for behind any new idea? How important is it for an idea to be unique and commercially viable, for instance?
I could probably talk for half an hour on that question, but I'll keep it very brief. I mean, we do a very thorough evaluation process of all ideas that come to us, and we look at a variety of things. We look at, you know, does it actually solve the problem that the innovator thinks it solves? Is there something already out there that solves the problem? Is the problem they have localized to their particular area? So in other words, does it have, you know, a large market? Will it be able to be adopted and scaled and used across NHS Scotland and across the wider world? We also look at things like technological feasibility. You know, can it actually be made and manufactured if it's a medical device? Can it be scaled? Will it generate a revenue return for NHS Scotland? Because the reason we were set up in the first place was to do that, was so that NHS Scotland could benefit financially from the good ideas that its staff members have. So we look at a wide variety of things. It's not just, you know, is there already IP there? Is it novel? Is it unique? We look at a variety of different things, and each one of those counts towards, is it something that we can support? Is it something that we can put money towards? Is it something that we can help develop and roll out? But I should say, just because, you know, we typically select about 1 in 10 ideas that come to us for development, and just because we say no, it doesn't mean it's a bad idea by any means. It doesn't mean it's not going to go somewhere. It doesn't mean it can't make an impact. And in those cases, we will always try to give as much feedback as we can, and always try to help the innovator take it down a different route with the local health board or with a company or academia, if we can at all.
Okay, thanks, Robert. I think we've probably got time for a few more questions. But I guess following on from your answer there, Robert, here's a question that links into it. How developed does my idea need to be before I approach InnoScot Health?
That's a good question. I suppose typically when we take ideas, and we take them at the fairly early stage, so we need somebody to have at least had this sort of the grain of an idea to a solution to a problem. So if people come to us just with unmet needs or problems, that's not quite enough. They haven't innovated. If they come to us with a potential idea, a solution, even if it's a sketch on a bit of paper, or maybe they've even produced a little prototype themselves with some, I don't know, elastic bands and lollipop sticks. I mean, I'm being a bit facetious there, but we have had one in the past that was like that. If they've come to us with that sort of solution, that is much more something that we can work with and take on and develop. You know, if it's a piece of software, if they have an idea for how their app is going to work and what it might look like, and they've plotted it out, that's much better than coming to us and saying, oh, we could really do with an app and a platform for helping people with, I don't know, hepatitis C self-monitor their condition at home. So we need a little bit more than just an unmet need, but we take ideas, you know, across the range, really.
Okay. Here's the next question, and I think might be one of the final ones. Is there information on the innovations that have been successfully implemented through previous calls?
Maybe ask Neil that one actually as well, just about in terms of ship and ship results, because I'd be interested to know that as well.
Yeah,
if you publicise that.
Yeah, absolutely. So in terms of the ship catalyst calls, because they're a pretty new process, we aren't yet at the stage of you know, having developed innovations and then deployed them and implemented them. So that will hopefully be something that we'll be seeing pretty quickly, though, because the successful catalysts are already starting to deliver that way. And if, in terms of other projects or immediately preceding projects from the innovation hubs, the innovation hub websites have got some nice use cases of those stories and the products and services that have been developed. There's some useful videos on certainly on the West of Scotland West of Scotland Innovation Hub website as well, and on HISIS and in the North Innovate website. So I can share the links to those if that's useful. Yeah, have a look there. Quite often you'll find that some of the successful projects that have bigger partners have got videos that have been created with their big tech partners. We've just done one with Microsoft around some of the vCreate video work that we've done here in Glasgow, and it's scaled nationally as well.
Thanks. I think from our side, from InnoScot, I mean, my colleague Fiona has just posted a couple of points in the chat that point people towards our web pages where you can find out more about the products that we've commercialized over the years. I would say as well, if anyone's attending the Emergency Response Retrieval Conference tomorrow and Friday in the Golden Jubilee, we'll be there, and you can see some of our emergency response products there, including the famous scram bags as well. Leigh, is that anything else, or are we?
I think that's all the questions, and I think we're at time. So if you want to go ahead and wrap up, that would be great.
I will do so. Thank you everyone for attending. Huge thanks, Dr. Neil Patel, for joining us today. That has been massively appreciated, and it's been fascinating to learn about the things that you're doing at SHIP and get an insight into, particularly to women and children's health. Just to say, the next few webinars in our series will cover these topics, which hopefully you can see on the screen. So 24th of May, we have one on medical device regulation, which is always a hot topic. the 21st of June, Protecting Your IP, break for the summer, and then we're back in August with one on clinical entrepreneurs. So anyone who is a clinical entrepreneur or budding entrepreneur or interested in doing an innovation fellowship, that would be one to come to as well. But I'd just like to thank everybody for attending today. I hope you found it useful. And please do drop us a line if you want any more information about what we're doing, about what SHIP are doing, about what Neil's doing. Thank you very much.